Hello everyone. Welcome to today's episode of BirthVibe by BirthRight. I am Dr. Preethi Reddy, fertility specialist, and I am joined by my colleague Dr. Varalakshmi, senior obstetrician and gynecologist. We'll be discussing on the topic pregnancies conceived with fertility treatments and whether they are considered as normal pregnancies.
Hello, Dr. Preethi. Thank you for inviting me.
So, to begin with, Dr. Varalakshmi, see, I think in today's world, we see that there's so much of social stigma around, fertility, infertility rather. And we see that patients still hesitate to approach a fertility specialist directly. They'll want to, see a gynecologist as a primary caregiver when it comes to having fertility problems. So why do you think that couples still have this hesitance surrounding fertility treatments?
Yeah, Dr. Preethi, I think still in our society, fertility treatments are still a stigma. Yeah, so they always see fertility treatment as not natural, not natural conceiving, and especially in our society, many women think that the family, many women first thing that comes to fertility treatments is something wrong with the women. So it is still a social stigma. So they always hesitate, although fertility specialists and fertility department has branched out and advanced in many ways. Their still first point of contact would be a gynecologist.
Yes.
Yeah. So they always, whenever they come to us, so it's not, I mean, we always talk to them first and then explore what her problem is, and then do some basic investigation. So because after one or two visits, they start developing confidence, and they also start understanding what the problem is, or we start counseling them in terms of that they will need to go for the fertility treatment. So that is the point where instead of initially referring straight away to them to the fertility specialist, so after some baseline investigations and explaining them and counseling them that they would need further help in terms of their, and they also reassure them saying that it's not fertility treatment always, because also the other common thing we see is that for them fertility treatment is only IVF. The first thing they think is it's only in vitro fertilization, but that's the reason why we refer them to you, and then you can always explain them about what are the various options they have. So, and then we refer them. So when we refer them to you, what are the challenges that you face when they come to you?
Yes, especially when when a couple having problems conceiving, when they consult us, and then they're fine to go ahead with evaluation. But once when the evaluation is done, we see that when we discuss with them on the problem or the treatment options, we see that there is a hesitance, to accept the problem. So they want to hear that everything is normal and they'll get pregnant normally, because they still consider that, fertility treatments are artificial. So it is not artificial, it is actually assisted. So when you say that ART treatments, it is assisted reproductive techniques and not artificial reproductive techniques. So they think that, there is something that, the embryo grows outside the body in the lab, in the test tube. So they perceive that it is something very artificial. So that is a major challenge we see with the patients. So I think, but when we talk to them, when we counsel them that, they have this particular problem, may not be in the first visit, but, after a couple of visits, when we actually, talk to them and explain the treatment. See, all of the patients don't need an IVF. It is only about 15 or 20% of the couples who come with fertility problems need IVF. So there are ways, there are other treatment options in the sense, when we evaluate, everything can be normal and we just advise them to try naturally. Or sometimes, the support which we give them can be as simple as an ovulation induction, or it can be, very basic level of treatments like an IUI. So it is only about that 15-20% of patients who actually need an IVF.
Yeah.
So I think with, constant counseling and giving them support, the acceptance is better.
The other common question we see from the women whenever we refer for fertility treatments is whether there is an increased risk of birth defects or increased risk of multiple pregnancies.
Yes, very true. I think the major concern surrounding a fertility treated, conceptions. I think it is majorly about they're worried about increased risk of, congenital issues, birth defects, or risk of miscarriage. And the other thing is about multiple pregnancies.
Yeah.
So there is enough evidence to say that fertility treatments per se don't increase the chances of birth defects in children born with, IVF or IUI. It is the fertility problem itself can actually put the pregnancy to a little higher risk, but not the fertility treatments.
Yeah, and also, sorry to interrupt, Dr. Preethi, but I think these women, we also have to see the age of the women. So, a lot of other factors come into consideration. It is not just the fertility treatment per se that is increasing the.
Yes, I rightly said, because see, most of the fertility, patients coming with fertility issues, they may be above 35 years. So obviously, the age itself is a risk factor there for them, which they fail to understand. Then they attribute, the entire issues or the entire problems to the fertility treatments and not the underlying problem what they have. So major issues, which I think, we usually counsel them, is more about the, the risk of miscarriages, and that is actually, age related, or somebody who's got a PCOS. When somebody has got a PCOS, the problem itself, or the problem of hormonal imbalance, can itself put a higher risk of having a miscarriage, and or having some subnormal sperm values. So that having subnormal sperm parameters, that itself can lead to a miscarriage. So it is the fertility problem which can increase the risk of miscarriage and not the treatments alone.
Yes.
And the second thing, congenital or problems or the birth defects, there's just a slight increase of 1%, but again it is to, related to the underlying fertility issue.
So the way we tell when they ask about birth defects is that, where, in general population, if you look at, there's about 3 to 5% risk of, even for normal couple, there's a risk of birth defects. So this is about, I would say,
Yeah,
5 to
actually, if
6%.
they've conceived normally, the risk of birth defects is 2 to 4%.
Yes.
When if it fertility treated pregnancies, it is 3 to 5%.
3 to 5.
So it is only about 1%
So
increase.
when the way I tell these women is that still 95% are normal.
Correct.
So yeah. And it is not statistically significant.
The only difference, how the pregnancies can be different is in the first 3 months, especially when we really have to give them more support in terms of progesterone and for the pregnancy to continue, or it can be more close monitoring and to, maybe a couple of scans more compared to normally conceived pregnancy. So for the first 3 months of pregnancies, there's a closed monitoring which is done. And then after the 3 months of pregnancy, when, there's a, the pregnancy is going well, then we shift the care to the obstetrician.
Yeah. So the next question is about multiple order pregnancies, higher order pregnancies, where, the fertility treatments, always there is an increased risk of twins, and also the other twins are still okay, but then triplets and higher order pregnancies are a challenge to the obstetrician. So I think in the present world, having higher order pregnancies more than triplets or twins is like a criminal.
Yeah, the outcomes are not good.
Yeah. So what do you do to optimize to reduce the risk of higher order pregnancies?
Yes, see, fertility treatments as such increase the risk of multiple pregnancies. So when it comes to, basic level of treatments, that is ovulation induction or IUI treatments, we monitor the scans. I mean, we do a follicular monitoring, wherein if the number of follicles we see on the scan, if there are more than 3 follicles, we tend to abandon the cycle. So maximum what we could allow a woman to have is a twin pregnancy, but not beyond that. So, and if it is an IVF cycle, then, the cycle control is absolutely, there's a good control on the cycle. So we don't transfer more than 2 day 5 embryos. So maximum possibility for a woman to have will be a 20% chance to have twins. So as an obstetrician, Dr. Varalakshmi, how is a pregnancy with a twin pregnancy different from a single-term pregnancy?
Yeah, so twins pregnancy, always it's the complications like miscarriage, or the complications, mostly the premature labor and delivery are common in twin pregnancies as compared to singleton pregnancies. So when we see a patient who has undergone fertility treatment, who comes to us with twin pregnancy, so like you said, after the first trimester, we can wean off most of the medications that you start. So even in twin pregnancy, we put them on basic supplements after the first trimester. The other additional treatment or the care we give is that we have to monitor the risk for premature labor. So it is in some places, or in many people also ask whether they have to undergo routine cervical stitch done for people with twin pregnancies, which is not evidence based, which is we don't do it as a routine practice. We always evaluate them for the risk of premature labor, like we do cervical length assessment time to time on the scan. We continue giving them progesterone medication, because after till the first trimester it is the progesterone support, but after the first trimester in twins we continue, because that is shown to, in many studies it is shown to reduce the risk of premature labor. So we continue them with vaginal or injectable progesterones and do a cervical cerclage. The common question they ask us is about complete bed rest.
Yes.
Yeah. It's not only about multiple pregnancies.
Yes, even if it is an IVF
conceived
pregnancy,
pregnancies, they would want to go, they will ask, doctor, is it
bed rest mandatory?
So that is a definite no. Bed rest
Yes.
is not going to help in any way.
So for that matter, actually, even after an IVF, we do not recommend a bed rest.
Yes.
We only ask them to, go slow or take rest, but an absolute bed rest is not advised.
Yeah. Generally, what I tell people is that listen to your body. You don't overexert yourself. At the same time, you don't have to, completely, because not only the women, even the family is like that, that they have to, but it is very much proven beyond doubt that they have to be active, and they can do the same activity, or the exercises or prenatal exercises that we advise for a singleton pregnancy, they can continue unless they have complications like a short cervix, or they have undergone cerclage because of risk of premature labor. They can be treated as a normal pregnancies.
Yeah, coming back to this question, Dr. Varalakshmi, see, once you have a woman who's conceived with an IVF or say with an IUI, and she's crossed her 3rd month of pregnancy. So is there any difference in the kind of care you would give her in terms of pregnancy care and delivery aspects?
Yeah. So most of them come to us in the second. So we see them in second and third trimester.
Yes.
So like I said, the fertility treatment per se, we don't treat them separately, especially after the first trimester. They are treated as any, if the mother is if it is a singleton pregnancy, mother is in late 20s or say 30s, doesn't have any medical risk factors like hypertension or diabetes, and she's not very obese. So if we treat them very much like normal spontaneous conceived pregnant women.
Yeah, Dr. Varalakshmi, after the first 3 months of pregnancy care, we shift their antenatal care to an obstetrician. So how is this care, antenatal care and delivery, different for a fertility treatment conceived pregnancy?
Yeah. So really speaking, we don't treat them differently. If it is just because it is an IVF pregnancy, we don't treat them differently. So it all depends upon whether it is a singleton pregnancy or a multiple pregnancy, whether the woman has any medical complications like diabetes, hypertension, obesity, if the woman has any complications. So we don't treat them differently just because it is an IVF pregnancy. Because see, that term of precious pregnancy is an old term now. So every pregnancy is precious, exactly. So we treat them really like a normal pregnancy. The only difference is if it is, like I already said,
but do you term it as a high risk pregnancy?
We don't. We actually don't. The high risk pregnancy, IVF itself is not a high risk pregnancy unless the woman has other. But IVF with multiple pregnancies, we consider it as a high risk pregnancy.
Even if it's a normally conceived pregnancy.
Even if it is a normally conceived pregnancy, multiple pregnancies is a high risk pregnancy. Yeah, but only if there are any medical complications, we consider it as a high risk pregnancy.
And is cesarean section a must for IVF pregnancy.
And definitely, it's not a must for IVF pregnancy. This I would say with very much of confidence, because we do a lot of normal deliveries even after fertility treatments, including the women who are elderly. So, elderly or the fertility treatment is not an indication for going for a cesarean section. Again, we get this question very often from women saying that because it is, we did not conceive naturally. So, do you think we should go for a cesarean? And one of the things is that many a times we get the request from the mother itself.
Yes, I think the patient request is
Yes.
majority.
When most of the times we explain them that, that we monitor the pregnancy during labor to check for the risk of any fetal baby going into fetal distress, and we have a low threshold for cesarean section if there is any problem that arises during labor. So so most of the times they accept and go for they accept for normal deliveries. Yeah.
To wrap up this session, I think it is important for us to recognize that fertility treatment conceived pregnancies, though they may have a different path to conception, but the journey ahead is very much normal as a normal conceived pregnancy. So thank you all for listening to us today, and please share this video if you have found this informative, and it will definitely benefit a lot of couples out there who are seeking fertility treatments. So until next time, stay safe and stay informed.